Impetigo versus herpes labialis. Cold sores. Herpes labialis, cold sores, and impetigo are contagious skin conditions appearing around the mouth, but have different causes and treatments. Cold sores are viral, caused by herpes simplex virus type 1, causing tingling, clustered fluid-filled blisters that scab over. Impetigo is bacterial, presenting as red sores, with distinct honey-colored, golden crusts. While both impetigo and herpes labialis, cold sores, cause facial sores, they are fundamentally different in their biological causes and clinical progression. Cause of rash. Impetigo is caused by bacterial infection, which can be either staphylococcus or streptococcus. Herpes labialis is caused by herpes simplex virus. Appearance of rash. Impetigo has red spots that quickly turn into larger, pus-filled blisters, which burst to leave thick, yellow or honey-colored crusts. Herpes labialis has small, fluid-filled blisters that cluster together on the lips, often starting with a tingling or burning sensation. Location of rash. Impetigo rash often appears around the nose and mouth, but can spread to other areas of the body. Herpes rash is mostly on lips and mouth. Sensation of rash. Impetigo rash is usually itchy, but painless. Herpes rash is painful tingling or burning. Recurrence of rash. Impetigo rash rarely reappears once treated. Herpes rash frequently recurs in the same spot. Spread pattern of rash. Impetigo rash spreads rapidly across the body if scratched. Herpes rash usually remains localized to the lips or nose area. Primary age group. Impetigo rash is most common in children aged 2 to 5 years. Herpes rash can affect anyone, often first contracted in childhood. Contagion timing. Impetigo remains highly contagious until the sores have healed, or until you have been on effective antibiotic treatment for usually 24 to 48 hours. A cold sore is contagious from the first tingle until the scab has completely fallen off.